I am Dr. Sunil George, nephrologist, Baby Memorial Hospital, Calicut. Today I'll be dealing about a very common but very distressing symptom, that is edema or swelling. Whenever we have a swelling or edema in any part of our body, we become very anxious. And many a times we equate edema or swelling with a kidney disease. I fully agree that edema is one of the most common symptoms of a kidney disease. But let me inform you that edema doesn't equate to kidney disease. There are also several other conditions like a heart problem, a liver problem, or a hypothyroid problem, or maybe a vascular problem, or maybe some other medicines relating to a swelling. So it doesn't mean that every swelling you have a kidney problem. So what are the common causes of edema? I would say number one, definitely a kidney disease. So whenever a patient has a facial edema, a facial swelling, or a leg edema, definitely he should consult a doctor to rule out a kidney disease. So in addition to the swelling, the patients will have other symptoms of kidney disease like nausea, early morning vomiting. He'll also have anemia. He will have generalized itching, etc. Or he'll have alteration in his urine also. He will have a decreased urine output. He can have a frothy urine output. He can have a cola-colored or a blood-stained urine, etc. So all these symptoms, additional symptoms, can lead to the symptom being a kidney problem. What are the other common causes of edema? If we have a heart problem, a cardiac problem, when there is a poor pumping or a left ventricular failure, as we say, you tend to have stagnation of blood in your body, especially in the lower limbs, and you have pedal edema or edema of the legs. And these patients, when they lie down, the extra fluid goes into the lung, and they have a condition known as orthopnea or paroxysmal nocturnal dyspnea, wherein they have to suddenly get up in the middle of the sleep and they become breathless and they sit up and go to the window to take deep breaths, etc. So this should make one doubt that swelling is because of a cardiac problem. The other common causes are a liver problem. Liver, as we all know, is a very important organ which produces protein. So when you have a liver problem, the protein level in our blood comes down, and because of that, there is a oncotic pressure difference and you tend to have swelling. And this swelling predominantly happens on the abdomen. And in addition, these patients can have yellowish discoloration of the skin, jaundice, as we all know, and yellowish urine also. The other common causes of swelling are hypothyroidism. When you have a deficiency of the thyroid hormone, one can have swelling. This swelling actually is called mixed edema. The other swellings in cardiac problem, liver problem, kidney problem, it is called a pitting type of edema. Like if you press with your fingers on the body in the lower part of the leg, there is a pit, or you can see the impression of your finger. Whereas in thyroid deficiency, it's called mixed edema, wherein it's a non-pitting. The moment you remove your finger, the skin becomes normal. And other common causes of edema, as we all know, is a filarial edema, secondary to filariasis. Here also we get a non-pitting edema. Other very common cause of edema of the legs especially are some of the medicines which we take. Like medicines for hypertension, there is a group of medicine called calcium channel blockers, which includes nifedipine, amlodipine, cilnidipine, etc., which can also in the long run result to edema. So once we know the cause, I mean, if we withdraw the medicines, the edema also subsides. However, the newer medicines like benedipine, etc., for BP medicines, it is known to produce lesser edema. Other common causes of edema are a vascular problem. If there is a insufficiency to the blood circulation due to atherosclerotic disease, diabetes, or related to smoking, etc., you tend to have stagnation of blood in the legs and you have edema. But these edemas are generally unilateral. So whenever you have edema on one particular side or one particular leg, we can always exclude the other causes like kidney, liver, heart, etc. It could be more like a local issue, like a vascular issue or a filarial edema, or even a condition known as deep vein thrombosis, or even varicose veins. So these are the vascular causes which can also lead to edema. Being a nephrologist, I would like to add on to the edema part. We always know that the commonest cause of kidney disease is swelling or edema. But here the classical finding is that it's an early morning periorbital edema, that when you get up in the morning, you tend to have a swollen face and eye, around the eye especially. This is very common in a condition known as nephrotic syndrome, especially common in children, wherein you tend to lose urine protein, and you have a frothy urine, and the protein in the blood is low, and because of that you tend to have swelling. Other common causes, renal failure. As I told you, when the kidney functions deteriorate, when the serum creatinine, blood urea increases, there is retention of fluid in the body because the kidney is not able to excrete all the water we take in. So they tend to have swelling of the face, the legs, and if not treated, they can get swelling in the lungs, fluid in the lung, and they go into breathlessness or pulmonary edema. So whenever you have a swelling, don't panic. You definitely have to exclude a kidney disease, and you have to exclude other diseases also, like heart disease, liver disease, thyroid disease, vascular problem. And mind you, even if all these are normal, still there is a condition known as idiopathic edema or edema of unknown origin, where the patient can have swelling. And what we require there is only reassurance, a decreased salt and fluid intake, and maybe a little dose of medicines known as diuretics, which will increase our urine output. So next time you see an edema or swelling, please remember whatever I have told you. Thank you for your patient listening.